As a physical therapist and a multiple sclerosis certified specialist of over 11 years, I have found many ways to help my patients with foot drop walk better and reduce their foot drop. And the truth is, there's lots of ways that we can do this. One way is via some type of bracing. Another way is through exercise. And I'm a firm believer that if you are using a brace of any kind, I'll give you a few examples. If you're using a brace of any kind, you need to also be doing physical therapy specific exercises so that you don't get weaker. Oftentimes, if you are only using a brace and that's your primary focus to help improve your foot drop, you might notice that when you're not using your brace, your ankle gets weaker, your foot drop gets worse, you're tripping more often. So, what we're going to talk on today is exercises that complement a brace. Anytime that I say a brace, that is anything that can help reduce your foot drop. Examples might be an AFO or an ankle foot orthosis. Those are typically made out of carbon fiber, but there's of course other materials as well. And it's something that slips in your shoe and it goes up your lower leg, sometimes on the front of your shin, sometimes on the back or the side, but it extends up towards your knee. And it works by preventing your foot from dropping. And then there's another option of brace, which are things like the Dictus band or the Elevate 360. These work by assisting you lifting your ankle. So there's a rubber band or a strap that hooks down to the lowest eyelets in your shoe and it helps lift your ankle up. And then the third option for bracing is something that includes electrical stimulation, things like the Walk Aid or the Bioness. And before we touch on the exercises, which we'll get to in about 2 seconds here, I just want you to know that you don't have to choose. It doesn't have to be all or nothing. It doesn't have to be the brace or exercising. It can be both. And there's two exercises in particular that if you combine those with the bracing, you're so much more likely to walk better, improve your ankle strength, improve your ankle mobility and flexibility so that foot drop doesn't impact you as much. Of course, there's lots of exercises, including hip exercises and knee exercises, but today I'm going to show you the two most effective ones that I give to every patient that I work with who has MS and specifically foot drop. I'm assuming we all know what foot drop is, but I just want to give you a quick look at the different ways foot drop can present. So if you're watching this leg, specifically my toes and my ankle, foot drop can be when you're walking forward, your toes drag. Sometimes that's referred to as foot drag. It can also look like you're able to lift your ankle up, but you might scuff towards the end. It also can look like you can lift your ankle up, but you land with your toes first instead of your heel, like that. And the last most common way is to have a foot slap. So that might be you're lifting your leg up, but you have your heel touch and you slap the ground. You'll know if you have heel or foot slap if you can hear your foot slapping with every step. All of those are variations of foot drop, and these exercises we're about to do can help with that. 99% of the time, when it comes to multiple sclerosis, the reason for foot drop is either weakness on the front of our ankle, tightness on the back of our lower leg, or both. So that's what we're going to do our exercises for today. Let's start with the weakness on the front of the ankle. We want to strengthen the front of the ankle. One of the best ways to do this is to do the exact motion that is hard, which is lifting your forefoot. So you're going to be sitting up tall and have your knees bent at about 90 degrees or so. Feet are flat on the ground, but then you're going to move your feet away from you. So extend your knees just a little bit. This will make the exercise easier. You'll thank me later. So your feet are further away, still firmly planted on the ground, but your knees are extended. And we're just going to lift one leg. So you're slowly going to lift one forefoot up. Your heel stays down. Everything else attempts to lift as high as you can. Pause and then slowly lower. And then we'll do the other side. Slowly lift, pause, slowly lower. One thing that's always important mentioning when we're talking about MS is, as you can see, I'm lifting pretty high right now, But it's so important to remember that even if you have zero movement, it's still an important exercise to practice. That's the difference between traditional physical therapy versus MS specific physical therapy. With MS specific physical therapy, it's not the amount of movement that you see that means you're being successful with an exercise or not, or it's effective for you or not. It's the amount of effort you're putting in. The amount of effort you're putting in is what will equate to your brain finding or strengthening neural pathways. When you have MS, that neural pathway strength is what you need in order to get stronger. So even if your foot lifting just looks like this, that's amazing. Great. Keep going. Might sound or look silly, but just a little bit is truly going to make a big difference. The general rule of thumb, if you're trying this exercise right now and you're like, oh, that's easy, you might be going too fast. 9 times out of 10, when I'm working with a missing link member and they'll say, Dr. Gretchen, that's easy, what's next? I will ask them how quickly they're going and they'll show me, and they're moving about this pace pretty quick. Go slow, especially if you foot slap where you can hear your foot slapping. Slowly up, pause, and then slowly lower. That slowly lowering is extra important for the foot slap. You should feel the muscles in the front of your lower leg or front of your ankle working. These are the muscles that we are strengthening when we're doing that motion. If it's easier for you to do both legs at the same time, you absolutely can. That's personal preference. I like to do one then the other because it's a little bit more functional. When we're walking throughout the day, we have to lift one ankle, then the other, then the other. We never have to lift both at the same time. So that's why my personal preference is alternating, but it's up to you. Choose whichever is easiest. For 10 years, I've been helping people with multiple sclerosis. And what I've seen is that most people with MS have a desire to get stronger and walk better. But what they've tried hasn't worked. I've created a revolutionary program called The Missing Link specifically for people with MS, where I teach you how to strengthen your brain, your muscles, and the neural connection between the two, which is the key to seeing improvements in strength, walking, and everyday activities when you have MS. I put my right leg out to this side. Regular exercise often doesn't cut it. But it's not just exercise. You'll experience the warmth of our supportive community, where every small victory is celebrated and every struggle is met with encouragement. Check the link in the show notes to learn more about The Missing Link and see if it's a good fit for you. Okay, let's dive back in. The other component that we discussed that can cause foot drop in MS is tightness in your lower legs, specifically your calf muscles. There's 2 ways to stretch your calf muscles. Most people aren't aware of the second way. You can do this seated or standing. For today, I'm going to show you my favorite way to do it standing, and I'm going to use my rollator to do this. However, you can use a wall or anywhere that is sturdy. So what you're going to do is stand up as tall as you can. Hands are firmly on the rollator with the brakes on or touching a stable surface. You're going to step back with whichever leg you're looking to stretch. So this is my left leg. I'm going to step back with my left leg and keep my heel down. You want to make sure you're a distance away where you feel comfortable. If it's too big and you feel off balance, bring it in, just like I did. And then from here, you're going to lean forward while keeping your heel down. So the more I lean forward onto my front leg, the more of a stretch I'm feeling on my back leg. So that's what this stretch would look like. The second stretch is the same thing, but you're going to bend that knee. So first it was straight. You're going to bend it slightly, and then it's the same exercise. And what this stretches is the calf muscles that go lower. These are the muscles that are more towards your Achilles area, closer towards your heel. So this is stretch number 1. This is stretch number 2. And of course, you would want to do the same stretch on the other side. So you'll step back as far as you feel comfortable. Your stance is pretty wide. You don't want to be in this tandem stance and feel off balance. So your stance is wide, heel is down, shift your weight forward. For the stretch number 2, you'd bend your knee and lean. Now, if you have really tight hip flexors in the front of your hips, then when you do this, you might not feel a stretch in your calf because you feel so much of a stretch in your hip flexor, in which case you might want to try the other version, which is a seated version. I like to use non-stretchy items. So personally, I love using my canes or walking sticks. If you have a non-stretchy yoga strap, that works too. Ideally, you don't want to use a resistance band. You want to use something that won't stretch because you'll get a deeper stretch. So what you're going to do is sit up towards the edge of your chair, straighten one leg with your knee as straight as possible. And then you're going to hook your non-stretchy item under the balls of your feet and pull towards you. So ideally, your arms are doing all the work here, and you would feel a stretch in the same area as when we were standing, right on the back side of that lower leg. You'd want to hold for about 20 to 30 seconds, release and do it on the other side, and repeat that 2 to 4 times per side. As I mentioned earlier, there are other exercises that can help with foot drop, things like knee bending, like standing hamstring curls like this one, marching, of course, implementing these throughout your day, such as walking with exaggerated movement and exaggerated step. All of those with a specific program telling you what to do each day are inside my online membership, The Missing Link. But for today, I just want you to feel confident that you've got these 2 exercises, one strengthening, one stretching, that can help you with your foot drop with or without an AFO. But if you are wearing an AFO or using any type of brace, as we discussed earlier, it is imperative that you do these exercises too. Many of my Missing Link members and physical therapy patients and clients come to me because their ankles are getting weaker, even though they are wearing an AFO or a brace. And 9 times out of 10, it's because they were never told to exercise. So I always have a preference for my patients who are using a brace to exercise with the AFO or the brace off if you can do so safely. Braces are so helpful, and we should absolutely use them when we need to improve our safety. But when it comes to strengthening, we can't necessarily strengthen as much as possible if we're wearing a brace, because the whole point of the brace is to limit our ankle movement. So once you feel safe and you don't feel like you're going to have your knee crumble or hyperextend or anything that would cause pain or discomfort, exercise with the brace off so that you're using the brace when you need to, but you're also strengthening so that when you're not wearing the brace, like in the middle of the night, if you have to get up to go pee, in the morning, after you shower, when you're getting dressed, there's so many moments throughout our day when we're likely not wearing our brace. And in those moments, you need to have enough strength to get around. Or I guess you don't need to, but it would be nice, right? So that's what the strengthening and stretching exercises can help with. Maybe this could be where the promotion for the Missing Link goes. I hope you enjoyed these physical therapy exercises that can complement using an AFO or any type of brace to help reduce foot drop when you have MS. If so, please remember to hit subscribe, share this with a friend, and comment below to let me know what you thought.